Okay, good. This is Senate Health and Welfare. We're back. And we are looking at two bills. One, we're gonna start with S 183, which is the Agency of Healthcare Administration Reorganization Bill. And GovOps has been through it and made recommendations that, and just wanting to look at the bills because it has huge implications for this committee. And the folks who introduced it were Senator Hardy, Senator Lyons, and Senator Kitchell. And so I don't think Probst is going to be looking at the bill, but I thought it would be important for us just to remind ourselves of what is in there. And Jen, you put together a side by side.
Did. Good morning, Jen Gardner, Legislative Council. I did put together a side by side that I will put up. So this is
Maybe
I
maybe.
can't see
Bigger.
it.
Oh, that's good.
Why is it all elected?
This is 183. We're looking at the
Why is anything like this?
Agency of Human
Take it down,
Services.
put up a different version.
So did this come through here before?
No, we haven't seen it at all. I mean, originally, I had thought that we'd be able to take possession of the bill, but there's not time. And GovOps has been through it, so we'll look at it. If we decide we need to make an amendment, we can do that. May not be necessary.
I believe that's what we care to see. I'm not sure. It's a PPF
It is a
that was weirdly highlighted, so.
But just to add in, this is a bill that would be in committee, our committee of jurisdiction, and the reports that are coming back will be coming to us, and then whatever happens, it'll be a multi-committee event.
All right, so we are looking at, that's again, Jen Harvey, from the Office of Legislative Counsel. So we're looking at S 183, which is entitled An Act Relating to Planning for the Agency of Healthcare Administration, although in Senate Government Operations Committee amendment, you'll see that title will change by the end. So I'll just give you the high level overview of the bill as introduced and then what the GovOps amendment does. As introduced, it started with 20 findings all about the history and structure of the Agency of Human Services and the programs within its purview. And then section 2 created a working group to divide the current Agency of Human Services into two agencies, one Agency of Human Services and one the Agency of Healthcare Administration. And there was a working group created. It'd be the AHS secretary or designee, the commissioners of each of the departments in AHS or their designees, and other interested stakeholders. And it specified how the Agency of Human Services should be split into Agency of Human Services, that would be the Department of Corrections, Department for Children and Families, Department of Independent Living, so part of DAIL, and the Human Services Board, which is the fair hearing entity. And then the other would be the Agency of Healthcare Administration, and that would be the Department of Health Access, the Department of Mental Health and Substance Misuse, Department of Long-Term Care, the Healthcare Board, which would be the kind of the analog fair hearing board for the Agency of Healthcare Administration, and then the Vermont Health Benefit Exchange. And then directed this working group to also think about ways to improve collaboration, integration, and alignment of services, and how to do this split in a way that minimizes confusion and disruption. The report would be due January 15th, would take effect on passage. So that's the bill as introduced. As recommended by Senate Government Operations, there are no findings. So section 1 of that bill directs the Agency of Human Services Secretary, in collaboration with their Deputy Secretary and the Commissioner of each department in the agency, and also in consultation with the various advocate and ombudsman groups. So the Office of Healthcare Advocate, Office of Child, Youth, and Family Advocate, Disability Rights Vermont, the Office of the Long-Term Care Ombudsman, and other relevant stakeholders to consider options for re-envisioning the agency. So it doesn't specify it's going to be split into two, although it names that as an option to split it into two or more separate entities or restructure the existing one. It directs the secretary and these others that she's collaborating or consulting with to evaluate the current structure of the agency, identify some potential options for doing something different with it, and perform a cost benefit analysis of each. Come up with some recommendations to be implemented. Those would be due by February 1st, 2025, so a couple weeks after the January 15th in the original bill. Including the rationale for each option recommended, what the likely impacts will be, how the recommendations would improve outcomes and accountability, how they could improve collaboration, integration, and alignment of services, which is something from the original bill, how they could address the agency and its department's workforce challenges, how they could address their technology and facility challenges, how to do the transition and implementation in a way that minimizes confusion and disruption. Again, an idea from the bill as introduced. A proposed organizational chart, if there are going to be any restructuring happening, and the estimated costs or savings of implementing the recommendations. It also would take effect on passage, and the GovOps amendment would rename the bill and act relating to re-envisioning the agency of human services.
Ooh, I like that.
That's check.
Yeah, that was it, and
Trying to come up with.
so
different ways.
I guess, and I'm glad that Chair GovOps is here, so you can answer questions that folks might have. But in terms of removing the findings, I guess the intent was just to that for the original bill was to demonstrate that the agency has been reconfigured and different over time. So was there a just maybe we could want to talk a little bit about that.
Why we got rid of the findings?
Yeah, well, the entire bill, just.
Yeah, well, so the findings, partly it's my own, the chair's bias. I'm not a fan of findings.
Oh,
'Cause
okay.
people often argue over the findings more than the actual language in a bill. You know, to argue whether that was the true history of AHS or what the language is, and really I like the focus to be on what's gonna be in the law. So we just removed the findings, which also makes the bill much shorter and simpler.
Can you leave that up? You mind?
Oh, no.
And then in terms of the sort of structure, the original working group was just the secretary and the department heads and advocates. So instead of having an actual formal working group, we just had the secretary do it with her department heads and then stakeholders, but named specific advocates that have a sort of skin in the game, so to speak, in terms of the populations that they advocate for, and we heard from each of them and they each testified. And then sort of the committee talked about a number of different ways each that they thought the department or the agency, I'm sorry, could be reorganized. And so it was very much of, there are a lot of different ways this could be done. So instead of answering the question in the bill about how it should be reorganized, really let's ask the questions about the outcomes. You know, what in the end do we want the agency? We want it to be improved outcomes for people who are served by the agency. We want better accountability. We want to try to address challenges in workforce because there are significant workforce challenges that AHS is facing. Also facility challenges we spent a ton of time in here on the forensic facility bill. So there are a lot of facility issues. So really just sort of laying out what are the things we want them to think about when they're thinking about reorganizing or re-envisioning the agency. And then given all of those things, how might they reorganize or re-envision the agency? And we had the agency in to talk to us about it several times. And they're on board with this.
So, and I know Senator
Structure.
Clarkson is a reporter of the bill. We've got your chair here, so we.
You're the best. I know, I'm just here to do backup support.
Okay, all right. So committee questions so in the discussion and prior to submitting the bill, a lot of what is there, it has been elaborated, and the things that we had talked about in terms of workforce and other stuff is there. So if there is something that you would like to add, that's fine, but I think the way the bill is structured as it's come out of GovOps is fine, unless someone on the committee wants to add, subtract, amend.
I will also know, we asked them for the cost and for
That's
the
good.
savings of reorganization. Sometimes reorganizations are actually really expensive just to reorganize. So wanting to make sure that they tell us what they think it would cost or save.
So, but having the bill come out without having our committee at least have looked at it, I thought would not be a good news. So we're here, we're looking at it. And it's up on the floor this afternoon. So I'm just gonna say, let's leave it, and I will stand up and say maybe something after the presentation, but, unless I hear differently, we're good.
Thank you all.
Okay.
Then obviously the language in the bill itself is a little more specific than
Right,
the summary I
Yeah.
provided for the side by side.
Senator,
Do we have a side by side on the website? Because I can't pull
it's there,
it. Okay.
yeah. Or did we, Kiki, you put it up?
She did.
It's there.
I might need to resend
Maybe
it though, because
refresh.
it looks a little.
I tried that.
Oh, okay.
That happens once in a while.
That is Jen.
It's under Jen's name.
The original proposal and.
Yeah,
Yeah,
I,
sure.
I said, and
I emailed it to you this morning. Yeah, I sent it.
So wait, so you now have a side by side?
I appear to have gotten it and it is yet unopened. But I will promptly reopen it. I mean, I'll probably open it.
All right,
I send it to you again, because I'm not sure the one that's online. It looks, at least looked weird when I pulled it up. It looked like a whole bunch of things have been highlighted, in a way that made it hard to read, so.
Just doesn't come out.
I resent it to Kiki, because that's the version is.
Thanks.
Madam Chair,
yes,
if I may,
yes,
Allison Clarkson, reporter Bill, with Jen and Ruth here, what a team. I guess I'd like to say, given the year that we are facing financially and given the cost that this, and this is a huge undertaking, as you know, Ginny, because you're one of the co-sponsors of this bill. I think this is a great step forward. I think this at least gets the ball rolling. And this bill has been introduced for now, as I mentioned, several biennium. So it is, I think, we haven't taken a step forward on this. I think this is a great beginning. Yeah, sorry. I guess that's where I leave that.
and it's a baby it's one of Senator Kitchell's strong interests.
Yeah, she has seen it. I sent it to her as well.
Yeah, and I spoke with her about it yesterday and.
Good.
I think this is just a
Good.
good start.
Yeah, I think the next step is gonna be a multi-committee event. Interesting. So, let's move along.
Thank you. Back to Senator.
Thank you for coming in, appreciate it.
I managed to come in and not fall into the witness.
I know, we're moving.
Well, I appreciate
that.
Practice.
Well, the last time I came in,
I know you-
fell into, and sadly, she is now no longer with us. The witness I fell into, my constituent.
That's true, I forgot,
She died,
that's
yeah.
right, yes, she did,
I love Judy Simon best,
yes,
but anyway, yes.
okay.
There are fewer people in the room too. That was a very.
I know, that was a really crowded afternoon.
Thank you very much.
Yeah.
See you all at 1.
Okay.
Hi,
Terrific.
Hi.
So it's the X18 side by side. I can't pull it up either.
You can?
Yeah.
Maybe you could repost those.
Oh, I just pulled it up.
Did
On
you?
the front.
I had it up earlier, yeah.
Yeah, I'm allergic to perfume and it's
Oh.
really,
Is it-
struggling
I'm-
today.
Catherine, can we turn on that
The
little
little air.
air machine for us, please?
Oh, there it goes. Now it's up.
So,
The
thank you.
F18.
And so we'll just all speak loudly.
And if I can't breathe, I am gonna leave the register.
Sorry about
That's all right, you don't have to.
All right. Are you ready to move on to SAT? You want me to put that up?
Please,
All right. So
this is
Yes.
the bill now that is on our notice calendar, or it's up from the House to us. And our job is to review the differences between what we did and what the House has done. And then we have the choices of concurring with further proposal amendment or asking for a conference committee. Or do we? Okay,
All right, so this is S18, an act relating to banning flavored tobacco products and e-liquids. Which this committee worked on last year, so you may not remember everything in great detail. So I've tried to kind of summarize what is in each of the sections. The version that came out of the House is fairly significantly different than, I mean, there's a lot more in it for one thing than what came out of this committee, and I would say, sort of to give the spoiler version, and you probably already heard or read about this, but the ban on flavored tobacco products is only for menthol flavored tobacco products, which means that other flavors of, for example, chewing tobacco would continue to be available at retail sale. All right, so that's much further on in here.
Just menthol? What about
We will,
apple spice?
we will,
Candy
that is for tobacco products, not e-liquids, not
Okay.
e-cigarettes.
Okay.
All right, so starts out, and because eventually the sections don't line up, I've put most of the section numbers in parentheses here. So section 1 in both bills is findings. The Senate version had 10 findings. The House took out many of the findings, but left in your findings numbers 1, 2, and most of 8. So that's a bit on cost, a bit on youth use, and a bit on menthol cigarette usage and non-white persons and among lesbian, gay, bisexual, and transgender smokers, and some tobacco marketing efforts. Section 2 in both bills is amending 7 VSA chapter 40, which is the whole chapter on tobacco products. The Senate version had amended the definitions of tobacco products, tobacco substitute, and e-liquid. The House version just took a completely different approach to definitions generally. They took just about all of the definitions spread throughout the chapter and put them all into the beginning of the chapter in the definition section. So it moved definitions into the definition section. It mirrored some of the definitions in Title 32's tobacco taxes chapter, so we didn't just have cross references going back and forth. It updated some terminology and put the definitions in alphabetical order, so it looks completely different. It does add some of the new definitions that you added as well around characterizing flavor, e-liquid, flavored tobacco product, flavored tobacco substitute, and they added a definition of nicotine. They did in later stages in the Ways and Means Committee narrow some of the definitions that talked about other substances because of some concerns of unintended consequences. So it's fairly specifically focused on products containing nicotine to the extent that we have nicotine or other substances. Because of the way the definition of tobacco substitute was broadened in the Senate version and continued in the House version that talks about introducing a vapor or aerosol into the body for inhalation. There was concerns about, for example, nasal spray, if we said any other substance. And so it was focused back on nicotine. There may be opportunity this year or in future years to refine that, but wanted to flag that for you. It also adds, the House version adds oral nicotine products. So these are, for example, pouches that contain nicotine in them that people put in their mouths and absorb it through the tissues of their mouth, as opposed to using any kind of a heated process. And it expands the definition of tobacco paraphernalia to include, and includes adding clothing or accessories adapted for use with tobacco products, tobacco substitutes, and e-liquids. Currently, there are some, for example, hooded sweatshirts with where the drawstring is hollow and you can put a tobacco substitute, an e-cigarette in there, sort of camouflage that. So when we talk about tobacco substitute or tobacco paraphernalia, we're including those wearable types of items as well. Backpacks. All right, so then 7 VSA section 1002 is the existing statute requiring a license to sell tobacco, say tobacco products, and meaning the larger group of tobacco products, tobacco substitutes, tobacco paraphernalia, et cetera. So the Senate version updated the terminology to use the newly defined term e-liquids. House version does it well. It also removes a now unnecessary cross-reference to a definition in Title 32, because those definitions were brought in to the definitions section. 7 VSA 1003 is the section on sale of these items. The Senate version had updated the terminology to use e-liquids, but otherwise made no changes. The House version adds a new prohibition on knowingly enabling the usage of tobacco products, tobacco substitutes, or e-liquids by a person under age 21. This mirrors the alcoholic, or similar to the alcoholic beverage statutes about knowingly enabling the consumption by a person under 21. And this is added in addition to the existing prohibition on selling to a person under 21. So you can't sell to them, you also can't knowingly enable their usage of these items. It moves, the House version moves the penalties for selling or providing items to minors from another section, section 1007 to 1003, so that we have both the prohibition and the penalties for violating the prohibition in the same section of statute, and applies the penalty to that knowingly enabling the usage. And it increases the penalties for violations from, under current law, up to $100 for a first offense and up to $500 for subsequent offense, instead to up to $500 for a first offense and up to $2,000 for a subsequent offense. Again, this is on sale of products to minors, sale of, or enabling the usage of minors. And it also adds a penalty, a specific separate penalty of up to $100 for a first offense and up to $500 for a subsequent offense on the employee of a retail dealer, in addition to the penalty for the dealer themselves. So this creates a financial disincentive both for the retailer in how it instructs its employees, but also on the employee themselves if they sell to a minor. It also updates the terminology to use the term e-liquids, as was in the Senate version. It expands an existing prohibition on vending machines, prohibitions on vending machines selling tobacco products. This adds, they also can neither sell nor dispense, and adds tobacco substitutes, e-liquids, and tobacco paraphernalia. It also revises the penalties for the sale or purchase of EDs, which are prohibited under current law, but there were different penalties for the sale and purchase, so the House has aligned the penalties.
Question.
What's it?
Yes, so they were covered under our existing law and moved but not changed. BDs are products containing tobacco that is wrapped in tamburni leaf or tandu leaf, or any other product that is offered to purchased by consumers as BDs or different spelling fees. It is a particular type of tobacco product that I believe is generally produced in Southeast Asia and contains much higher concentrations of harmful elements.
Because it's flavor.
No, it's just a different type of, has nothing to do with system flavor. It's just a different type of tobacco product.
So
it's been banned in Vermont for a number of years. There were penalties under existing law, just had a different penalty for the purchase and the sale. This aligns those. So under existing law, a person who holds a tobacco license and sells BDs as prohibited, prohibits them, the sale and purchase. A person who holds a tobacco license and sells BDs as prohibited by this subsection, an existing law is fined not more than $500, and the purchaser who purchased them from any source is fined not more than $250. So now instead we have the purchase and sale, both is $250 for a first offense and $500 for a subsequent offense. All right, it deletes a definition that was moved to the first section and adds definition of the new term, enable the usage of tobacco products, tobacco substitute, or liquids, that is based on the similar language in the alcoholic beverages statute. 7 VSA 1004 adds language on proof of age for the sale of these items. Your version, Senate version, added the e-liquid language throughout the section. The House version does as well, and also deleted a definition that was made to the first section, the definition section. 7 VSA 1005. This is persons under 21 years of age, prohibiting the possession or purchase of all of these items. The Senate version added e-liquids throughout the section. The House version also does and revises the section heading just to be a bit more reflective of what is in the section. Section 7 has to do with the posting of signs. Senate version added e-liquids. The House version is the same. 7 VSA 1007. This is language about furnishing tobaccos to persons under 21 years of age and some compliance reporting. The Senate version updated the name of the substance, and I think I got it right, the Substance Misuse Prevention Oversight and Advisory Council. The House version deletes the penalty for sale to a minor in this section because it was moved to an earlier section, and it updates not just the name of that council, but also reflects the updated name of the Government Operations Committee. Receives the annual compliance testing report. Section 7 is the statute on contraband and seizure. The Senate version added tobacco substitutes, e-liquids, and tobacco paraphernalia to the list of items that are subject to seizure and destruction if they are sold, offered, or possessed for sale in violation of the law, and updates the list of statutes prohibiting that sale, offer, or possession for sale. The House version is the same. 7 VSA 1010 is the ban on internet sales of all of these items. The Senate version added e-liquids and specified that each prohibited shipment of each of the items is a separate violation. The House version does the same, but also deletes definitions that were moved to the first section.
That's a good question. On the section, I'm just looking at the summary, not the actual bill, but, when prohibiting internet sales, how does that enforced? Because.
Well, we're gonna get there a bit later on, because
Okay.
there's a new investigator position being added in the bill, in part to be working on that. But it's enforced through the Department of Liquor and Lottery and the Attorney General's office under existing law.
Right, that's it, and it's been in there, it's been law for a while, yeah.
Yeah, and in 5-6 years.
Okay.
So
I know it's still happened.
Yep, and I think it's difficult to enforce, or more difficult than the retail sale in person.
Yeah.
But there is language that was added in a floor amendment to create a new investigator position specifically to focus on direct to consumer sales of tobacco, the larger tobacco group of items, and alcoholic beverages.
Okay.
Some recent compliance testing indicated 0% compliance rate. So at least in the compliance testing they had done, in 40 instances, they were able to purchase in all of them. All right, 7 VSA 1012 is e-liquids and other substances containing nicotine and their packaging. And the Senate version had updated language to use the term e-liquid. The House version is similar. It revises some additional language for consistency with the updated terminology in the bill, but the purpose is the same. And it deletes, again, some definitions that were moved to the first section of the chapter. All right, now we get more interesting. 7 VSA 1013 is the flavor ban. The Senate version added definitions of characterizing flavor, flavored e-liquid, flavored tobacco product, flavored tobacco substitute, and tobacco retailer. As I said, the House moved all the definitions to the first part of the chapter, but I believe all of those definitions are the same, except we didn't need one for the retailer because there was an existing definition. We just changed the terminology to be consistent. So that the Senate version prohibited the retail sale of any flavored tobacco product, flavored e-liquid, or flavored tobacco substitute starting on September 1st, 2023. Obviously, we passed that date, so we may need to update that. And there were penalties on a retailer of up to $100 for a first offense and up to $500 for subsequent offense. In the House version, they prohibit the retail sale of flavored tobacco substitutes, flavored e-liquids, and menthol-only flavored tobacco products. So those are cigarettes, which are the menthol is the only flavor allowed to be sold under federal law, so that doesn't make any substantive change for cigarettes. But for things like chewing tobacco, it would make non-menthol flavored or non-menthol flavored products that are flavored with a non-tobacco flavor still available. So cinnamon, mint that isn't menthol, any of those of tobacco products would still be allowed. And this would be effective January 1st, 2026, and they have a higher penalty, civil penalty, of up to $200 for a first offense and up to $500 for a subsequent offense.
Two questions. Are the penalties in the new version, are they against the user or the distributor?
They are against, no, that's all on the retailer, not the purchaser. The idea being nobody should be having these in the stores to purchase, so
And then
on the retailer.
the prohibition of sales of flavored tobacco, et cetera. Why the carve out for particular items? Is there anything you can share?
I think I would defer to maybe the reporter to give you the why. That was something that came up during the process and they made a decision, but I don't recall the specific. There was discussion of specific rationale. 7 VSA 1014, this was not in the Senate version at all, although I know this issue has been brought to at least the chair's attention by the Department of Health. This is around using coupons or prohibiting the use of coupons and other discounts to purchase all of these tobacco and related items. So the bill from the House prohibits the selling or offering of tobacco products, tobacco substitutes, e-liquids, or tobacco paraphernalia at a lower price than the seller purchased from the wholesaler. Basically, the retailer cannot sell it for a loss based on what they acquire it for. It also prohibits selling or offering any of these items through multi-package discounts. It prohibits honoring or accepting price reduction instruments for the sale of the items, and violations are subject to civil penalties of up to $200 for a first offense and $500 for a subsequent offense.
Senator Williams.
I thought they couldn't sell it at all.
These are not flavors. These are items. These are all tobacco products, tobacco substitutes, and e-liquids. So of the ones that would be remaining for purchase, they could not be sold using coupons or discounts or. All right, then we get into some of the sort of conforming change provisions for several of these. So 4 VSA 1102 in the Senate version amended the Judicial Bureau jurisdiction to add the violation of the ban on sale of flavored products. In the House version, it also amends the Judicial Bureau jurisdiction to update the provision on the violation of the ban on the sale of tobacco products to minors, and to add the Senate piece, the violation of bans on the sale of flavored products, and also to add violations of the ban on the sale of discounted tobacco products. Putting those all under the Judicial Bureau, which the language in Title VII does, but this is doing the conforming piece on the Judicial Bureau side.
Chair, could we get the fiscal note posted? No, it's not Nolan,
No,
actually, it's Ted Barnett, I just asked Nolan.
Okay,
Yeah, I find it, so, thank you.
well, we have the fiscal note that we use for our bill, so this would be a fiscal note for so we should have.
Yeah, the
both of those.
updated
We
fiscal
want
note
both
would
of
be
those together.
helpful.
All right, 7 VSA 661, the Senate had made a conforming change to add e-liquids to the description of 7 VSA 1005A. House version does the same. 16 VSA 140, Section 5 of the bill as passed by the Senate added e-liquids to the existing ban on using tobacco products and tobacco substitutes on public school grounds. The House version also added e-liquids to that existing ban. It updated the section heading and made a clarification on the reference to some definitions. And then it deleted, there's permissive language in the existing statute that says the public school boards may adopt policies that include confiscation and appropriate referrals to law enforcement. So the discussion in the House committee was that if it was permissive and they may, it didn't need to really say they may, because they still may. And there was concern about specifying referrals to law enforcement when they were really more focused on, as you'll see coming up, cessation, trying to get kids off of products and not necessarily encouraging policies that include referral to law enforcement. ATVSA 4226, there is no similar provision in the Senate version. In the House version, this allows minors 12 years of age or older to consent to treatment for dependence on nicotine, tobacco products, or tobacco substitutes. So this is, we talked about this in the context of another bill, but an existing statute on minor consent to treatment for drug dependence, dependence on alcohol, and treatment for sexually transmitted infections. This is the same statute as that one, the existing statute, but it's adding consent to treatment for dependence on nicotine, tobacco products, or tobacco substitutes. And it updates language in that existing statute to update some of the language to use terms like substance use disorder, instead of alcoholic is one of the words that's used in there, and sexually transmitted infection instead of venereal disease. 18 VSA 4803E, the Senate version makes conforming language change regarding e-liquids in the statute on the duties of the Substance Misuse Prevention Oversight and Advisory Council. The House does the same. Section 7 of the Senate bill amends 32 VSA 7702 to make some conforming language changes in the definition of other tobacco products in the tobacco tax statutes to reflect the updates made in 7 VSA chapter 40. Now we're up to section 8 of the House bill. It does the same. Next two sections were not in the Senate version. One is somewhat substantive, the other is not. So 18 VSA 9503, section 9 of the House bill, it amends the Department of Health's tobacco prevention and treatment section to specify that a minor's use of a quitline can be based on the minor's use of tobacco substitutes or e-liquids in addition to cigarettes. 33 VSA 1900 just updates a reference in that the Medicaid statutes to 7 VSA 1001 for the definition of tobacco for purposes of the statutes in Title 33 dealing with the master settlement agreement with tobacco manufacturers and related issues. So long explanation for a pretty ministerial change. The next section is on the Health Equity Advisory Commission and the menthol tobacco product ban. There was no similar provision in the bill as passed by the Senate. In the House version, it would require the Health Equity Advisory Commission to include in its annual report in January of 25 a recommendation about whether the sale of menthol tobacco products, including menthol cigarettes, whether the sale should be banned in Vermont. So that report would come back in January of 2025. The ban doesn't take effect until January of 2026. The idea here was to allow the legislature to make a change if felt appropriate. The next section is on tobacco substitutes and e-liquids and advertising restrictions. Section 8 of the version that passed the Senate requires the Office of the Attorney General to report by December 1st of 2023 on whether and to what extent Vermont can legally restrict advertising and regulate label content for cigarettes and other vaping products in Vermont. Section 12 of the House bill is similar, and that language, again, it moves out of the report date until December of this year, and it uses slightly different language, and it includes oral nicotine products. The next section is the Department of Health's Vermont Youth Risk Behavior Survey. Section 9 of the bill as passed by the Senate. You may recall the Senate Finance Committee added a provision requiring the Health Department to report by March 1st of 2027 on the results of the 2025 Vermont Youth Risk Behavior Survey relating to youth use of tobacco products, tobacco substitutes, and e-liquids, and compare it to the results from prior surveys. The House version is the same, but also requires data on the sales of tobacco products, tobacco substitutes, and e-liquids during the period 2024 through 2026 calendar year. Almost done. Next section is on the Department of Health and school-based usage and cessation. There was no similar provision in the Senate. The House version requires the health department to collaborate with school and community partners to survey and report on the use of tobacco products, tobacco substitutes, and e-liquid, and on nicotine and tobacco cessation efforts in Vermont schools. It requires the health department, in consultation with the Division of Liquor Control and the Court Diversion Program, to develop some options for diversion to a tobacco cessation program for people under 21 as an alternative to the civil penalties and fines in the existing law. And that report is due by January 15th, 2026. Next section in the House version, again, was not in the Senate. This is the one I was describing before. Creates a new investigator position at the Department of Liquor and Lottery to investigate and enforce the laws on direct to consumer sales and delivery of alcohol and tobacco products. That appropriated $160,000 from the Tobacco Litigation Settlement Fund in FY25 for the position. And it expresses some legislative intent. So it's maybe a little easier to describe than just to read language here. The idea is that we would use Tobacco Litigation Settlement Fund money for the position in fiscal years 25 and 26, and then have the Department of Liquor and Lottery build this position into their base budget starting in 2027, but use the revenue from the fines and penalties from the investigators' activities to pay for the position, with anything in addition to the cost of the position going into the general fund. And there's language in there saying, if at any point it seems like this position isn't paying for itself anymore because compliance is so good, then Liquor and Lottery should propose getting rid of the position. There's a report due first on March 15th of 2025 about how the position is working out, and then annual reporting by December 15th on the impact of having this investigator on compliance with the direct-to-consumer laws. Finally, we have effective dates in the Senate version. Section 10 had an effective date for the whole bill of September 1st, 2023. The House version has the changes to the tobacco statutes, the Judicial Bureau jurisdiction, and various conforming changes taking effect January 1st, 2026. The findings and the minor consented treatment for nicotine and tobacco use and the reports would be effective on passage, and then July 1st, 2024 is the new investigator position and appropriation, and first annual report would be due in December of 2025. And that is yours.
Okay, so there are a lot of changes in here, significant. But so the biggest one for me is the flavored tobacco is not effective except
menthol.
Except for the menthol. So what we're doing is we're kicking kids off of vape and moving them over to tobacco. Okay.
Well, there are no other flavors of cigarettes allowable. Nope, it's prohibited under federal law.
Okay,
So only menthol is the only flavor of cigarettes allowed to be sold under federal law.
And federal.
Right, so there would not be other flavored cigarettes available under our law, but other tobacco products would still be able to be sold. And tobacco products,
Does that include the little cigar thing?
is little cigars, yes, cigarettes, little cigars, roll your own tobacco, snuff, cigars, new smokeless tobacco, and any other product manufactured from, derived from, or containing tobacco that is intended for human consumption by smoking, by chewing, or in any other manner.
Okay. All right.
Defer to the members of the House Committee to give you their rationale.
Questions committee on what's here. I think what we might have to do is to go through it one more time.
I think it might be helpful to go through and look at the language. I mean,
Yeah,
you're
I
just
think
saying
we
my
should do
summary
that.
of the provisions.
But we'll make some time tomorrow. I'm gonna have Kiki open it up a little bit for tomorrow. So that we can do that.
Can we also have Ted in to talk about the fiscal note?
Yeah, we can do that.
That would be helpful, thanks.
I hear what you're saying about the menthol piece, but there is that report coming from the Health Equity Advisory Committee.
Yes,
So
right.
hopefully,
That'll offer some clarity.
yeah.
Yeah.
And maybe will encourage further action in the future.
Right, I think the Health Equity Advisory Commission report is specific to ban menthol, don't ban menthol. And the flavored tobacco products question is ban just menthol or ban all flavors that are tobacco. So these are somewhat, they're related, but somewhat different questions. But yes, it would be an opportunity certainly to revisit.
Could go any direction. And we, I'm just sort of reminding us of the testimony that we heard from the national experts on this, Dr. Garland and Mr. Jefferson. The focus of tobacco marketing on LGBTQ and folks of color, so that's Black Americans. So the result is we market, we get a result of more intensity use in those cohorts.
And then are you planning to look at the occupational therapy licensure compact? You have this, the reporter from, or the sponsor of the bill from the House, so I just wanted to.
We are going
recognize the
to do
representatives.
that. So I think what we'll do is we'll hear from the sponsor. We'll come back to this one. This is our first look. It will be up on the floor and we'll have to make a decision as a committee how to proceed. And we will do that. I'm hoping that we can do it quickly, but I know there's a lot here. So welcome.
Thank you.
We're switching gears to something you would like to tell us about. 47. Occupational therapy.
Yes, thank you for having me.
Thanks for the photo the other day.
Oh, yeah.
That was great.
Representative Mary Catherine Stone, she's for the record. Good morning. Thanks for allowing me to come into your committee and provide testimony for H 247, which is an act relating to Vermont's adoption of the occupational therapy compact. I know that you already had testimony today about social therapy compact. Compacts are not new to you. But just wanted to come in and talk about this one in particular. As you all know, I'm a legislator, obviously, a proud representative of Chittenden 14th in Burlington. But I'm also someone who trades in my power suit in the off session to put on a pair of scrubs because I am an occupational therapist. And I worked in the field for over a decade, and I currently practice at Fanny Allen in Colchester, Vermont, which is part of UVM Medical Center. A lot of you may be thinking, occupational therapist, you must help people find jobs. That could technically fit under the scope of my profession, but I want to take this opportunity to educate you on what occupational therapists are and what we do, and why we play such a vital role in our healthcare system. We help people of all ages. I say womb to tomb because you can find us in NICU units all the way to nursing homes and palliative care. Participate in life activities, also known as occupations. That's where the name comes from. We tailor our interventions to help people engage in activities that they want or need to do, including taking care of themselves and or their family, working, volunteering, going to school, among many other things. We also provide recommendations for things including, but not limited to, adaptive equipment, home safety and accessibility, returning to work, school, leisure activities. Because we have such an expansive scope in our profession, we work in a variety of settings. Home health, skilled nursing facilities, inpatient acute care, rehab hospitals, like outpatient clinics. I'm asking for your thoughtful consideration of this bill as it affords more occupational therapists greater access to practice here in Vermont. I will tell you, as an OT who practices in this state, we need more of us. I feel a lot of guilt every year that I, well, it's now the second year that I have to leave Fanny Allen to come here because we don't have enough OTs to fill the patient caseload that we have. So we should be making it easier and not harder for people to practice here. And as y'all know, the majority of our state's population is older and or reaching older age, and our patient caseloads are growing more complex as a result of that. There are currently 28 states that have already enacted a compact legislation, which is more than half of the licensing jurisdiction of our country. So if enacted, this compact will allow OT therapists and their assistants the opportunity to practice in states that have joined the compact without having to secure a new full traditional license in each state, which is redundant and laborious. It takes a lot of time. It took me 5 months to get my licensure transferred over to this state, even though I practiced in Alabama and Washington DC, which, I mean, seriously, I was licensed to be able to treat the President of the United States children at Walter Reed Hospital, but it still took me 5 months to get my licensure all set up to practice here when I moved. The OT compact before you helps break down a lot of the barriers that I just mentioned. It preserves the regulatory authority of each compact member state to protect public health and safety through the state's existing regulatory structure. So our state's unique scope of practice will still be honored. It's not anticipated to yield substantial additional cost. I know folks from JFO and Lunch Council are here to walk you through the bill and give you the fiscal note. There may be some cost associated for additional software to connect the compact's data system, as well as cost associated with the attendance of Vermont's chosen commissioner to the annual in-person OT compact commission meeting, and that information is listed in the bill. There's no financial beneficiary of the licensure compact, and it's not intended to generate profits, and it's anticipated that any fees collected via setting an appropriate fee, which was proposed by the House, what that fee will be for the compact privilege will offset those administrative costs. This was the first bill I sponsored. Spoke with legislative council about it only a few weeks after I was elected in November. So before I even got into this building, and as soon as I got in the building, I hit the ground running. I collected the large number of signatures that we received on the co-sponsor list. Planning veteran legislators told me I didn't need to do that. It wasn't necessary. I just needed one signature on that bill and it was mine. But I kept going because it's really important for me to share just how special and how needed this profession is. I'm really proud to be an occupational therapist, and I know firsthand we should be making it easier, not harder, for OTs to practice in the state that we call home. So I strongly encourage you to take this up and pass it swiftly.
Thank you. Thanks for your testimony. Thanks for the work that you're doing. You know that one of my former students was the first leader on the children's floor at the Mary Fletcher Hospital. Was an OT and she was amazing. Like the work that you do, and she worked with kids, but obviously the work you do at Fannie includes older Vermonters as well, people with injuries. Do have a broad spectrum of patients to deal with. Yeah, it's great. Thank you. Questions for Representative Stone?
Hey,
Terrific.
I'm a dark back to education committee then.
Oh, good. We'll do a good work.
Thanks
You're
for
a good educator. You just
Yeah.
educated us.
Yeah, that was great.
Yeah.
Thank you.
Okay, have a nice day.
All right.
You too.
So why don't we do this? Why don't we look at, hear from Nolan on the fiscal note, and then we'll try to, and then we'll go through, with Jen and see how far we got. We'll have to, obviously.
I just updated my section by section for, so
We're
that's the house, so we can go through the section by section.
We're experts on compacts now.
We're getting good.
We are so good.
Good morning.
For the
Well, good
record,
morning to you too.
yes, for the record, no.
So when we skip from bill to bill, we sit right here. But when you skip from bill to bill, you skip around the,
We're getting our steps in, for sure.
get your steps in.
Did you literally skip?
No.
Oh,
No skipping.
you were fast on that response, Jen. Absolutely not.
I've tripped, but those.
Okay, go ahead.
Yeah, for the record, Nolan Lang with the Joint Fiscal Office, I would just entertain, if you guys are experts, maybe you should testify to me on that.
Oh, it's gonna cost us some money.
I'm just kidding. I'm not gonna go through all the little murder we're all, did last time. But, unless you want me to, I mean, last
It's
time
okay.
I went through and I told you how many, I guess I will.
Okay.
All right, so Vermont renews its OT and OTA licenses in May of even years. Remember, all these are like even or odd years, different months, $180 again. Revenues again are put into the OPR fund. According to OPR, there are 573 OTs and 100 OTAs. Don't need help on the acronym this time. Licensing of those, 82 in 24, OTs and OTAs respectively are from states that have signed on to the compact. Other states that have established in the, there's 28 states currently in the compact, so unlike the other one, which was still being established, this one is established as 28 states that include New Hampshire and Maine, so those are our neighbors that have them. And according to the American Occupational Therapy Association, 4 more states, including New York, Massachusetts, and the District of Columbia, have legislation. So that was as of February, maybe things have changed since then. The estimated revenue loss is approximately $19,000 biannually. And then another 77 OTs and 7 OTAs are from states with pending legislation. So the first estimate was on those that have passed legislation. So all the ones that are pending legislation, it could have a further loss of $15,000. That's biannually, not annually. If they sign on. So in all, potential revenue loss from licensing fees could be about 19,000 to 34,000, 34,200. OPR also estimates there would be approximately 3,400 to 4,800 additional from lost application fees. This one does allow a privilege fee, so that some of them do, and some of them don't. I believe a lot of the social work ones do not allow a privilege fee. If you recall, privilege fee is when the state can charge on top of that to practice in their state. So the bill sets a $50 privilege fee, so some of that money would be offset. We estimate between $5,300 and $9,500 of that could be offset. So total revenue loss could range between 17,000 and 29,000. As I said in the other ones, OPR has some cost to implement this one, just like the other ones, it's about $10,000. That's one time, not total. If more states join the compact down the road, the revenue impact could be greater. And the last thing is that Vermont will, if we join, would pay a nominal fee to the compact commission to be part of this. I don't think it would be more than $2,000 per year. So that's the quick high end. Cheap compact. So it's funny, I pull out. I literally pull these out. I'm like, which one am I doing now? I'm literally sitting down like, which one's? Oh, okay, because they're all similar and different.
All similar and different. Mostly similar, they're all the same and different.
I feel your pain.
Go ahead.
Is there an appropriation in the bill at
There
all?
are appropriations in the bill.
Okay.
The only appropriation that would be needed would be for OPR. And
Right, I mean, it says the $10,000 cost to their licensing system, so I'm assuming there would be a similar cost for the social work one, or not?
yeah, as a matter of fact, there's a
Yeah.
cost for all of them.
Yeah, so I'm just
They begin to add
wondering
up.
if
Yeah.
we,
And then you're gonna hear for the peer support, there's a cost and for.
Yeah.
but you said the House appropriations is working on something?
Yeah, so they didn't put appropriations in the bill because I provided them with the information to take that into consideration in their budget. If they don't do it, then OPR is gonna pay for it. But I assume, I don't know, I can't assume what they'll do, but I provided them with a sheet, and I'll remind them that like, the bill will be passed, the costs. I think we're looking, I don't remember, I don't have it in front of me, but it had all the different ones we passed last year, as well as what we passed this year, just that's,
Would you send?
yeah.
I have the miscellaneous OPR bill.
Oh, that's
So, yeah. Way to collectively look at some of the costs of these.
Do that.
Thank you.
Other question, go ahead.
I understand the access to care benefit of entering compacts for sure, and general benefit to our healthcare landscape. What, is there a financial benefit? I can't remember if we discussed that last year, to entering into the compacts. There's a cost, obviously. Is there a benefit?
Well, you could consider increased workforce availability, filling gaps. Yeah, are we in the nurse compact? yes,
Yes.
we're in the nurse compact, and we still have travelers. So, and we talked about how can we get the nurse compact nurses to replace the travelers, so we're not spending so much money.
Right.
So there could be a benefit there, it's, yeah. We hear there's a benefit.
On the individual level too,
Yeah.
so that you don't have to pay multiple license fees if you want to practice in multiple states. So for the individual OT or social
Right.
worker or nurse or whatever it is, they have usually have a savings.
So Lauren is up there. Are you ready to say something, Lauren? about
Lauren
this?
jump on,
Yeah,
or
she is. And Senator Williams, go ahead, ask your
So
question.
we set up, basically a wage for our nurses, they make so much money. So if they join it, if they're a nurse and are in compact, what's the benefit for them to come to Vermont? If they're not gonna make the travel nurse,
They love Vermont.
okay.
I don't know. There's some questions that we probably should dive into a little bit and follow up on some of these compacts. Because I know that the PA and the nurse and have been around a while. So, and Lauren, maybe you could help us out with that, the question that's been asked.
Yes, so Lauren Lehman, General Counsel OPR for the record. We do have we had to submit a report at the beginning of this year detailing the impact of the nurse licensure compact. And so I can share that with you as I can submit that to Kiki after today. The upside of it is there's significant revenue loss. The travelers no longer, so folks from out of state, if they want to work here, we had travelers before, we have travelers now. They no longer have to purchase a license from OPR to work here. So that's a loss of revenue to the state. And so we've had a significant, we have a lot of outgoing folks, but we've got a lot of incoming folks as well. I mean, even though we've lost the revenue, it's been essential to staffing our healthcare facilities over the last 4 years. So without it,
So let me ask you a question, and then we probably, this is a moved off a little branch from the bill. However, has the nurse compact governing body discussed the significant effect that travelers are having in states? So I know that many states are affected by the high cost of travelers, and has the compact group talked about that? You don't need to answer the question right now, but it's something we've been concerned about, at least I've been concerned about before the compact was passed. So let's, we'll keep that one over on a sidebar, but it would be great to know what discussion is happening at the national, the group. Okay. Thank you. So Jen, do we have time to take a quick run through of the section by section on this bill? Thank you, Nolan.
Zoom. All right. So yes, I updated my section by section to reflect what happened in the House. And so the bill, which itself is 41 pages, so this is a 5-page version for you.
Let's do the 5.
It starts out by just doing some cleanup housekeeping stuff. It designates the existing provisions of the occupational therapy as subchapter 1 of the chapter it's in, and creates this new subchapter 2, which is the occupational therapy licensure compact. Starts out by saying Vermont intends to adopt the occupational therapy licensure compact. It goes through the purpose language, and as you recall, compact language is pretty much set when we get it, so we're just have to do it all or not do it. So it talks about the purpose of the compact, facilitating interstate practice and improving public access to occupational therapy services. The objectives, helping people practice, occupational therapists and occupational therapy assistants practice in more places, while still allowing remote states to hold the compact participating provider accountable to our practice. Also includes the use of telehealth. We do understand there is some telehealth that occurs in occupational therapy as well. We have our definitions. I pulled out some of the main ones that apply here. The compact privilege, which is that authorization equivalent to a license that we would be granting to a licensee of another state to practice as an occupational therapist or occupational therapy assistant here under our laws and rules. And the practice occurs in the state where the patient or client is located during the encounter. We have the home state, that's the state of primary residence for the licensee and where they get their main license, the single state license. There's a jurisprudence requirement can be part of the licensure process or compact process. Member state is the state that has enacted the compact. A remote state is a state that's not the home state where the licensee exercises or wants to exercise their compact privilege. And a single state license is the regular main license, where it wouldn't be for other states. So if somebody was seeking a single state license from Vermont, they'd be getting our regular license. It doesn't entitle them to practice anywhere else. State participation in the compact talks about what the obligations of the state are. We have to license these professionals. We have to participate in the compact commission's data system, have a mechanism in place to receive and investigate complaints, notify the commission about adverse action against or investigative information about a licensee, consider criminal history records of applicants for an initial compact privilege, and you'll see language at the end that specifically adds this profession to OPR's list of professions for which they can seek criminal background information. States have to comply with the commission's rules, use only a nationally recognized examination as a requirement for license, and require continued competence or education for license renewal. Does allow states to charge a fee for granting the compact privilege, so that's that privilege to practice fee that Nolan was talking about. And again, non-residents can continue to get a Vermont-specific license, but that doesn't give them a compact privilege. So then it talks about what is required to exercise the compact privilege, how long it is valid, that a licensee providing occupational therapy in a remote state has to operate within that state's laws and regulations. Occupational therapy assistants that are practicing in a remote state must be supervised by an occupational therapist who is licensed, whether as under a single state license or compact privilege in the remote state, subject to the remote state's regulatory authority when you're practicing there. What happens if a home state license is encumbered and if a compact privilege in any remote state is removed. Obtaining a new home state license by virtue of the compact privilege. So a practitioner can only hold one home state license at a time, but you can get a single state license in multiple states. You just can only have one home state. You can have a full license in multiple states, but you only have one home state. And it talks about what happens if a practitioner moves from one member state to another. They have to get a new home state license in the state where they are living. And what's involved in there. There's some provisions about active duty military personnel and their spouses. They have to designate a home state where they're currently licensed in good standing. They can keep that home state designation while the service member is on active duty, even if they're temporarily relocating. But after they designate a home state, they have to go through the home state designation change process to change it permanently. Adverse actions, we would still have, home state would still have exclusive authority to impose adverse action over the home state license. But remote states can take adverse action against the compact privilege in the remote state. And then some language about what happens if an adverse action is taken by a home state. against a license, then the compact privilege in all other member states is deactivated until all encumbrances are removed from the state license. It establishes the Occupational Therapy Compact Commission. This is similar to the compact commissions you've seen in other states. We would be a part of this if we were part of the commission. There's a data system that the compact commission has to set up. It's my understanding that while there are a number of states, like Colin cited, 28 states have enacted legislation. As of my last information from a few months ago, this compact was not actually live yet because the compact commission was still getting itself stood up. But there are data system requirements, rulemaking requirements. These are all on the commission. Talks about what happens if a member state defaults, oversight, dispute resolution, and enforcement provisions. Date of implementation. Again, compact is to come into effect on the date of enactment of the 10th member state. We're well past that, but it doesn't seem to be quite up and running yet. It's about how you can withdraw, state can withdraw from the compact. And amendments to the compact are only effective and binding if they are enacted by all member states. So it's pretty hard to make a change to the compact. There's a construction and severability, some sort of standard language around that. If anything here is invalid or unconstitutional, split off the part that isn't allowed and keep the rest. Compact is binding. And then we have the couple of provisions that are amending Vermont law. So section 3 allows OPR to do criminal background checks for occupational therapists. There's a specific list of occupations that OPR is authorized to conduct criminal background checks. It has been growing as we've been doing with compacts. And then there's also the OPR privilege to practice fee in section 4. And that would set a biennial $50 privilege to practice fee for a licensee of a remote state under our compact. This is different from the regular biennial renewal fee of $180. And the effective date would be July 1st of 2025. That was the date requested by OPR, as they're working on getting us ready to participate in a lot of compacts. And that is it. I buzzed through a lot of the language, pretty similar.
That's okay.
To other compacts.
Yeah, that's okay. We'll come back to this at some point. So we have done a lot today. Lauren, did you want to comment at all at this point?
Thank you, Lauren Lehman, General Counsel, OPR, for the record. I just wanted to say that, again, OPR is very supportive of this compact and adopting this compact and facilitating interstate practice. We have financial concerns, but those can get worked out in other spaces. This model is slightly different. It's a privilege model, as Jen just alluded to. So when somebody wants to work under the compact, they notify the compact commission, hey, I have my home state license. It allows me to work under the compact. I want a privilege to practice in Vermont, New Hampshire, and Maine. And so then they pay a fee for that privilege to practice in Vermont, New Hampshire, and Maine. So it offsets some of the costs in a way because we are able to charge for practice in Vermont. It's a lower level, but we are able to recoup some of the costs through that.
Sounds like a good model.
It is. It's the one most are following this at this point.
If we did that with nurses, we might fix problems. Anyway, okay, questions? All right, thank you. Thanks for being with us this morning. We do appreciate your time.
Of course, thank you.
And so tomorrow we have one more compact that we'll look at, but Kiki's gonna sort of structure our time so that we also can look at S18 again. And look at the fiscal note and then have an opportunity to work with Jen just to understand the bill, what's there.
Yeah, and I don't know if you want to invite Representative Brumstead.
I think we might do that as a
The
reporter.
main ones.
Yeah.
Which one is it tomorrow? Okay, which compact?
So I'm just looking
your
at
support.
not a compact. I feel like
It's just,
Kate was very
just
clear
the
that it's
bill
not a compact. It's a
Oh, okay.
certification, but it's not a compact.
Okay,
with my
great.
compact head on.
Here's.
It's a bill. We may do the walkthrough or have the reporter come in, but then push that off a little bit so we can spend more time on S18. Just a heads up. All right, that is good. That's a wrap. We're finished the day.
Thank you all.
Thank you.